If you've just had prostate surgery or you're facing a Peyronie's procedure, there's something your surgeon may not have told you, and it could mean the difference between recovering your full length or losing it permanently. Here's what's actually happening inside your body after penile surgery, and what the clinical evidence says you can do about it. When a surgeon performs a radical prostatectomy, the neurovascular bundle that feeds your erectile tissue gets disrupted. The same principle applies after Peyronie's plaque incision and grafting. The graft itself needs to remodel. This is where the science gets genuinely encouraging. It's called Mechanotransduction. Penile traction therapy preserves corporal length, keeps surgical grafts aligned. The device behind most of this research is SizeGenetics, an FDA-registered Class II medical device. The protocols vary depending on your surgery. After radical prostatectomy, most patients get clearance 4 to 6 weeks post-op. And speaking of safety, this isn't something you wing on your own.